What are stroke risk factors, and how can you control them? There are some risk factors for stroke that you can control with behavioral changes and your doctor's help. And then there are some risk factors you cannot control. The ones you cannot control include age. Risk for stroke increases over age 65, but they're occurring younger all the time. Sex and race. African Americans have a much higher risk for stroke than the general population, as well as Hispanic Americans. Men tend to have strokes starting younger than women, but women tend to have more disability or die from them. Family history of stroke at a younger age, in the 30s, 40s, and 50s, may indicate a higher risk for other family members. Persons who've had a stroke or a TIA are at higher risk to have another one, especially if they don't control what caused the first one. Now let's look at risk factors and behaviors you can control to lower stroke risk. The number one way to lower your risk for stroke is to control high blood pressure. It can be controlled with lifestyle changes and with medicines. The desired blood pressure goal is 120/80. Get your blood pressure down now, and you lower your risk for stroke, period. Control diabetes. People with diabetes have a higher risk for stroke. Control your blood sugar and your high blood pressure. No tobacco. Smoking increases the risk of heart disease and stroke. Your doctor can suggest programs and medicines to help you quit smoking. Treat atrial fibrillation. Atrial fibrillation is an irregular beating of the heart. It can cause clots that can lead to stroke. A doctor can prescribe medicines to help reduce the chance of clots. Control high cholesterol. High cholesterol is a major risk factor for heart disease and stroke. This includes eating a diet low in fat and cholesterol and high in fiber. Your doctor may prescribe medicine to help lower it. If you drink, limit alcohol to 2 drinks a day for men and 1 drink a day for women. If you're overweight, change your eating and drinking habits, as well as increasing your daily activity level to lose those extra pounds. Regular physical activity. Work toward a moderate level of physical activity for at least 30 to 40 minutes per day, 3 to 4 days a week. You don't have to do it all at one time, and any type of physical activity that you can do will help. Diet and nutrition. A healthy diet can help to lower blood pressure and cholesterol levels. This includes smaller portion and plate size, eating more fruits and vegetables, reducing the amount of salt in your food, drinking more water, and eating less saturated fat. Now let's talk about living with a stroke. The following will outline several strategies that you, your family, and your friends can use to adapt to your new life after stroke. See your doctor as prescribed and write down questions for your appointments. Make sure that all your doctors know what medicines are prescribed to avoid duplicates or drug interactions. Research has shown that it is possible to improve function for many years after a stroke. The brain can create new pathways, but constant repetition is needed to make changes in the brain. Therapists can help patients improve and reduce their disability after a stroke if the patient is motivated to do so. Therapy is hard work, and it can be tiring, but it's definitely worth the effort. Strokes are life-changing events that require intense rehabilitation to regain function. Don't think that only attending therapy a few times a week is enough to meet your goals. It requires consistent effort from you every day. Caregivers and family members cannot take care of their loved ones if they don't take care of themselves. Get help from family members and friends. Consider hiring help or even using adult daycare to give the caregiver a rest if needed. Don't feel guilty about wanting or needing to get help or have a rest. Now let's talk about ways to improve communication. Direct your comments to the stroke survivor. Don't talk around them as if they're not there. Slow down when you talk to them. It often takes a little more time to process information. Be brief and use simple layman's terms. Too much noise, light, or activity can be overwhelming. Avoid having the television, radio, or other noise on when talking with the stroke survivor. Wait patiently for the person to respond to the message. The more the stroke survivor repeats and rehearses new information, the more likely he or she is to remember it. You may need to repeat back their questions or concerns, or you may need to repeat instructions. Now let's talk about improving memory and thinking strategies. Doing the same tasks at the same time each day helps reduce forgetfulness. Store everything in its rightful place to minimize confusion about where it is. Journals or organizers can help keep track of questions to ask or tasks that need to be performed, as well as appointments to be kept. Hang a bulletin board or a dry erase board in a highly visible place so you can post messages. Advanced planning helps reduce the risk of forgetting. Wristwatches or timers that you can program for specific times will help cue when it is time to take medicines or to perform important tasks. Avoid stores or restaurants during peak times. The noise, light, and crowds can be overwhelming. When attending a crowded place, sit near an exit so that you can leave quickly if you begin to feel overwhelmed. Let's look at ways to improve speaking, eating, and swallowing. It is important to continue the diet used in the hospital until told differently by a speech therapist. This includes thickening of liquids, if applicable, to avoid the stroke survivor choking or getting pneumonia from food in the lungs. Continue any chin or head position given in the hospital for eating until changed by a speech therapist to prevent choking or getting food or liquid in the lungs, causing pneumonia. Reintroduce social situations gradually. Watch for signs that the survivor may be getting tired or overstimulated. Use lots of herbs and spices rather than salt to improve the taste of food. Feel free to puree their favorite foods, as well as whatever the family is eating. Medication safety and management. Take a list of all your medicines with you on every doctor visit for review. Include all the over-the-counter medicines, vitamins, and herbals. List any allergies you have, and all drugs that you're taking for any current medical condition. Aspirin is a very important medication. It helps prevent blood clots. High blood pressure medicines are very important for stroke survivors as well as anyone with high blood pressure. Take them exactly as prescribed and don't quit taking them without checking with your doctor. Coumadin, a blood thinner, must be managed carefully with dietary and bleeding precautions, as well as checking blood levels on schedule. Use a pill planner to organize and remember your medicines for the week. Do not use any home remedies or vitamin supplements without checking with your doctor or pharmacist first. Do not share any medicines not prescribed for you or take any expired medicine. Now let's look at medication assistance. There are several ways to control and lower the cost of your medicines. One such example is a prescription assistance program for uninsured or underinsured people who have trouble paying for their medicines. These programs enable pharmaceutical companies to provide those who qualify with long-term medicines on an ongoing basis. RX for Oklahoma is one such program. Another cost saver is the Oklahoma RX discount card. It can provide a discount of 10 to 50% on many medications, and it is available to insured and uninsured alike. Check the list of low-cost generic medicines at your pharmacy to see if your medicines are on it. You can also ask your doctor to consider this option when prescribing a new medicine to help keep your costs down. Now let's look at stroke resources. There are many resources for stroke survivors right in your own backyard. Get to know what is available, how it can help you, and how to get started. Look for classes for stroke and TIA patients and families at your hospital to learn about prevention, risk factors, and local resources for stroke. Stroke support groups provide help for stroke and TIA survivors, families, and caregivers by sharing recovery, resources, and experiences. Speech and hearing clinics offered through local university speech programs provide low-cost speech therapy. Local resource information for seniors and those who are disabled is available through your local area aging agency. And finally, the most important thing to remember. We've discussed many things to think about in this series. We've learned more about a stroke, a TIA, what are the effects and warning signs of a stroke, and how to control risk for a future stroke. We've discussed tips on living with a stroke, medication management, and resources available to help with stroke and TIA. All of these are important, but there's one thing you must remember above all else if you or someone you know shows signs of having a stroke, and that is to act fast and call 911.